from a young age, I've been a very driven person. I think I saw that modeled in my family. A couple personal examples in my family. My mom was a nurse, one of the most amazing people. Extremely intelligent, very driven, would do anything for her patients. I saw that as just one of the many examples of my life. I have a grandfather that went legally blind in his 20s. Obviously, a very life altering event, but really didn't falter and changed the course of his life and made a better life for him and my grandmother and their at the time two young boys, one of which was my dad. And just the work ethic that I saw in them. On the other side, and I have my paternal grandfather. He grew up as a hard laborer, as a carpenter up in the coal regions of Pennsylvania. And again, a very just driven, hardworking, salt of the earth kind of people. And so I saw that modeled early on, and I just adopted that.
Hi, everybody. It's Dave Astorino with the Public Square Project. Today, we are interviewing Josh Gregory. He's an oral surgeon, and he's a whole lot more than an oral surgeon. Aside from being a very fit guy and a big personality, he's got a whole lot going on, and we're going to have him tell you about it. So, Josh, you're an oral surgeon. Tell us your background. I've looked at your resume, and you have a very storied resume, don't you?
I appreciate that very kind introduction, Dave. Yeah, it's been a journey to get to this point. I'm actually I'm assuming probably a good amount of the people at least watching this are from the local area. So I'm a local guy. I graduated from Salisbury High School. Born and raised in this area. Grew up in Emmaus. I did my undergraduate a dual major actually in biochemistry, molecular biology, and biology at DeSales University. Before going on to the University of Pennsylvania, where I did my dental school, my graduate training. And then from there, I went on to Geisinger Health Systems. Most of my time out in the central part of the state, out in Danville, some of it up in the Northeastern Territory in Wilkes-Barre and Scranton to do my surgical residency. So all of my training has been within Pennsylvania, not too far away from the central point of the Lehigh Valley. My goal is always to come back here, very close with my family and friends, and all my immediate family is in this area. So it's always it's good to be back home.
Glad to have you.
Yeah, thank you.
We're really glad to have you. Okay, what I get from you when I'm talking to you, and we met at the gym at the Lehigh Valley Fitness Center, and the guy I know is super driven. Just watching how you work out and the types of things you do, and the fact that you don't stop is really impressive. And I wanted to ask you a couple questions about really just where that drive comes from. Like, how do you get there? You're in great shape. You like I said, you don't stop, and that's a mindset. Like, where does that mindset come from? What drives you?
Yeah, that's a great question. From a young age, I've been a very driven person. I think I saw that modeled in my family. That was like my norm. That's what I was surrounded with. So I'm so blessed that I had that exposure to my family, and that was instilled in me from an early age, and that translates out into everything from my career academically, to, as you mentioned, just how I like to train. I have a laser focus. I tend to set my mind to a goal, and I don't stop until I get there, and I don't accept not giving it my all. Whether that puts
Right.
me, it's not necessarily to achieve some status or some level of prestige. It's more of a mental competition with myself to keep challenging myself. And as long as I know I put my best effort in,
Yeah.
that's what counts. And like I said, I mean, I really attribute that to my upbringing, just the wonderful family that I had and what they instilled in me.
So what is your next big challenge, Josh? You've accomplished quite a bit in your life. so far. Things are changing. The world is changing around you. What are you thinking about as your next biggest, hardest thing to do?
That's a great question. You know, and I can't say I have a definite answer. I can say that I'm more open than I've ever been in my life to saying yes to any opportunity that comes my way. You know, the caveat of our last topic that we were discussing of having that laser focus. Sometimes you don't take the time to smell the roses, as they say,
Yeah,
right?
you can miss
Because
a
you're
lot.
so driven and focused, you do miss a lot. I mean, there were throughout my training and schooling, I had to sacrifice a lot to achieve the level that I wanted to each step along the way. Again, I was never content with just making it by, as we discussed. So, but in doing that, you do, the flip side of it is you do miss out on some of the other aspects of life that are just as important in terms of living a full and whole and happy
Yeah,
life. It's not all just about a career and achieving that level. Um, so, kind of transitioning here, and you kind of at a juncture in my life where I'm changing careers, or changing at least what I first saw my whole career being. I've been dealing with a neurological issue that is affecting my bilateral, both hands. And unfortunately, or fortunately, I guess I should say, people look at me and they don't know anything is wrong. But it affects my fine motor skills. And obviously, as a surgeon, especially in a specialty where you're working in such a small area, we're talking millimeters. It became a patient safety issue, which is why I stepped out of the role as a surgical operating oral surgeon. So I say that because to your question, what's next? I don't know exactly at this point. Since I stepped away from operating, I've done a lot of learning about myself, learning about, as I mentioned, the things many aspects of life that I didn't build upon or allow to thrive while I was so laser focused on my career. And so over the last several months, I've really been, kind of like us meeting, for example. We met at
right.
yoga, right? And that's something that I would have never had the time to be able to do. And I wouldn't have, in all honesty, I wouldn't have made the time even if I could, because I was just so focused. That's just one example of many of the things that I've said yes to, opportunities that have come on my plate over these last several months. Um, doing a lot of different volunteer activities, doing things through my church, going to events with the homeless down in Allentown. And I think one thing we'll spend a lot of time talking about was I recently in May was on a mission trip, a medical mission trip to Africa. And again, talk about an opportunity that kind of fell on my plate. Wasn't really on my radar of anything that I thought I would be doing. And I said yes to it. And it was just a truly life changing experience. So I don't know. We'll go into that more, Dave. But in terms of
Yeah.
just getting back to that was a long ramble to answer your question, but I felt like the context was necessary. So what is next? I don't know. I'm excited for it. I can tell you that. If you talk to me when I first stepped out of surgery, I was definitely in a different headspace than I am right
Yeah.
now. But already I feel like I've been able to pursue many aspects of my life just from the time I've gotten to spend with family and friends to the travels I've done to the volunteer activities I've been fortunate to take part in. I'm already seeing a lot that I don't think I really would have developed if I was still working, as a surgeon and so focused just career, and it made me
Right.
step back and pause. So the answer to your question is I don't know. I don't know, but I'm excited. I'm excited for it. I'm optimistic about it.
Well, Josh, that is a very fertile place to be. When you are open to whatever the universe is going to bring to you, and you're there to receive it, lots of things open up. There are vistas that you will not have seen before that will be presented to you. But things are going to open up for you, and you're going to find yourself saying, and the fact that you'll say yes to things will open even more doors because you're going to be running in circles that you weren't in before. And there are a lot of worlds happening at the same time. And you can end up in places that you would not have ever imagined that you'd be.
Yeah.
And it's a blessing. It's wonderful. You'll meet people that you're going to be enthralled with that you never would have crossed paths with before. It's going to be really great. So you mentioned that you did some work with the homeless in Allentown. And before we get into the mission thing, I'd like to know a little bit more about that, what you learned, and what you think can be done about that problem. Because there are two things in this world that I, especially in the United States of America, that I can't understand why and how we let them exist. One of them is hunger, and the other is homelessness.
Well, first off, with your question, it's an event that is held every Tuesday afternoon down in Allentown. It's called Loads of Blessings, and it's for the homeless and the underserved. And it's an event that I found out about through my church, and that's how I got involved. And there are a variety of things that go on down there. They allow people to come in. It's actually hosted at a laundromat off of Linden Street, and people come in and they, are allowed to do their laundry. That's one service that is provided. Their St. Luke's brings a mobile bus, a mobile van, and they provide some health screenings. I don't know the details of what all they provide, but they're typically out back. There's some drug and alcohol rehab programs that go on as well. And the capacity in which I help, there's a wonderful couple down there that they, I believe spearheaded the program to start providing food at this event as well. And so I go down and help them. We give a hot meal, and then typically we have leftovers and try to send people home with food afterwards. So it's a great event. Again, a lot of people come out. There's some wonderful people making a big difference. And to your bigger questions, I don't know, Dave. I don't have an answer for why or how we allow these problems to exist. I think there's been a lot of good intentions to solve them. Some of the programs that we have, government programs to try to address them, but I think they missed the mark in that I, I think there's somewhat of a cultural issue in this country. I think, a lot of these programs, they might provide the funding, they might provide the resources, which are important, but I don't think there's necessarily enough, for the phrase, teach a man to fish, right? I don't think
Right,
there's enough of self sustainability. I think
right,
you need to not just pour money, not just pour resources into a cause. You need to help a person learn how to, whether it's a career, whether it's, education on just on health and well-being. And
right, right.
it's beyond just pouring money and resources in. And I don't know how you implement that perfect program. But I
Well, there
think
probably isn't a perfect program.
no, there isn't. And it is a shame to see, again, like you said, in a country that has so much wealth that we have this problem. But I do think a lot of it is that, again, there's good intentions, but I think almost you can do more harm by just throwing money and resources at a
I agree.
problem, because then you create a state of dependency, and you don't
Right,
create
right,
a person that can better themselves and then better their family and then spread it on. It just becomes a reliance on a broken system of pouring money without any sight into what's next, what's going to be the
right,
result.
right.
So
There was a program up in, I moved from the Ithaca area and I was pretty involved with things up there. They had a program called Second Wind where a gentleman took a piece of land that he had and made a cul-de-sac, and I think he had 8 or 9 small houses, like tiny houses but bigger, sort of 2 rooms, bedroom, living room, kitchen, kind of open thing. And they took people who were previously homeless and gave them these homes. They had to keep it clean, and they had bus service so they could get out into the world. They could get downtown to Ithaca. They could get to stores and restaurants and things. And they had programs around that where they helped folks get jobs, helped them get counseling, and they turned around a lot of folks just by, and they were building more and more of these communities. And it isn't something that you move into and live in for the rest of your life. It's yours in the sense that it's an apartment. It's yours, and you have a place to go that is your home. That changes the way people think about themselves. And most of those folks have gotten jobs. And something like that had a big impact. It changed lives.
Sure.
I'm asking you questions that I know you can't answer. But I always like to get perspectives from people who are doing things in the world. And I get impressed, and I do things differently because I've spoken to them.
Yeah.
Is that what opened the door to a mission to Africa? Where did that come from? How did that originate?
Yeah, so that's again interesting with the time that I have as I'm in this transition stage. I started pursuing several different volunteer activities. I volunteer at Lehigh Valley Health Network. Actually, I do some volunteering there. I started at my church. I knew there would be an avenue to potentially volunteer through them, and potentially looked at doing some positions at the church itself. And I got to befriend a gentleman there who's a retired nurse. And he's actually the one that told me about the event down in Allentown. And it was actually through him. He always wanted to do a medical mission trip. And again, as a retired nurse, he has the knowledge base and skill set. And it was through him that he had this opportunity that he found out about. And then he thought I might be interested, and he's the one that told me. And it's amazing when you look back and see how things just came about. Like I said, nothing that was on my radar. And he told me about it. I went to some Zoom information sessions about it, and it just sounded like a great opportunity. And so I said yes, and he signed up, and that's what brought me to go. And like I said, I'm so grateful that I had the opportunity to do it. I feel like I experienced something that most people don't ever experience in a lifetime. And the fact that I was able to experience this at such a young age, I do think it's going to light a spark. It has lit a spark. I want to continue. It was my first time to Africa. It was an amazing continent. I highly recommend everybody to go. And it was my first mission trip too, my first international mission trip like this. And it was, it's something that I definitely want to continue. I went into it thinking that it would be a really deep and impactful experience, and it was tenfold of what I anticipated. Truly, and I don't take this terminology lightly. I mean, it was truly a life-changing experience. I feel like I have a perspective now coming back, especially to a country that is so fortunate, so blessed like the United States. Coming back here, it really has recalibrated me. So, I mean, a little bit about the trip. It was in Malawi, which is just west of Mozambique. So it's in southeastern portion of Africa. It is the fourth poorest country in the world. So a level of poverty that I just never, ever, ever experienced. We were in small, remote villages. We weren't in any centralized urban areas. There's different levels of poverty that are classified level 1, level 2, and so on. And we went to some of these level 1, classified areas where, there's no electricity, no running water, small huts. They sleep in the ground on the dirt. A lot of them didn't have shoes. Just again, like I said, a level of poverty which it just never, ever, ever experienced. The organization I went through was called Villages in Partnership. I can't say enough good things about them. It's a smaller organization, actually headquartered out of Allentown, New Jersey. And it was started by a pastor and his wife. And so it does have, a religious Christian affiliation. And the trip I went on was, again, a medical mission trip, but they do a variety of mission trips, and they have a variety of different initiatives that they work on. They do things with irrigation projects, where they'll set up an irrigation system, and most of the people in Malawi are sustenance farmers, and honestly, a lot of them can't even
Hmm.
sustain them and their families. So now, with something like implementing the irrigation system, some of these people can actually start to make money and send their kids to school, to college. So it's amazing. Beyond the time that we spent in the medical and the dental clinics, we got to go out into the communities and see some of these other initiatives. We got to see areas where they were digging wells. um, some of these
Right.
areas, these people had to walk miles just to get fresh water, and now something, as we think in this country, is so simple as digging a single well, can be truly life altering for these small villages. The organization also sponsors, again, building medical and dental clinics, building schools, sponsoring children to go to these secondary schools and to go on to university. So it was more than I was even anticipating. I didn't realize how much exposure I would get just outside of the medical clinics and the dental clinics, but we really got to be immersed in the communities. I could talk. This could be an hour, 2, 3 hour podcast if I could just talk about all the examples. And I think what's almost even more important is just kind of some of the overarching things that we saw and experienced during our time there. Before I get to that, two things that really struck me in terms of I guess more smaller level detailed stories that occurred in my time there. One thing that just really, we actually got the ability to tour one of their regional medical centers, and there's 4 of them in Malawi, and these are supposed to be the top hospitals, right? And it was just amazing to go into this facility, and considering what we have here, right? I'm used
Right.
to the American healthcare system, and I mean, it's just things we take for granted. Like, for example, we go into the hospital. If you're admitted, you order breakfast, lunch, dinner. There's clean linens on the bed. If God forbid you have an accident, they change the. This was just one thing that really struck me in the hospital, in the regional medical centers, right? The top hospitals, they don't provide you with linens. They don't provide you with meals. Families have to come in. They bring their bedding. Families
Oh,
camp
wow.
out, and they'll, outside the hospital, there's families everywhere sitting in the dirt, like everywhere. And they make pop up fires, and they're cooking over open flames, and they make the food for their family members while they're admitted in the hospital. And, it was just staggering to see the conditions. I was talking to one gentleman there, and it's like, I think of some of our hospitals around here that have like multiple helicopters, right? I was told, I didn't fact check or verify, but there's not one helicopter in Malawi. I couldn't believe there wasn't at least one. I think they had an incident several years ago where one of the surrounding countries had to have a helicopter that they were loaned. These people are either are walking miles and miles, or if they're fortunate enough to be in an area where there are very primitive ambulance, they're basically land cruisers that they put you in the back with, not not like a bit, not like our ambulances, and that's how they bring you to the hospital. So it was just amazing to go in to see the conditions that these people have to experience, and that was really enlightening to see what one of their top hospitals was like. Another scenario that really struck me, and left me like, wow. We got to go to one of the secondary schools that Villages in Partnership had built and sponsors children there. And we got to break up into groups, and they brought some of the kids out and had 4 or 5 students, and we'd get to speak with them in small circles. And we asked them a variety of questions, what their home life was like, again, what they wanted to be, what they were aspiring to do. But one of the things that really struck me is a lot of these kids, we're obviously so grateful for the opportunity to educate, to have a higher level of education at a secondary school that is doing so well and placing so many kids at university levels. And but a lot of these kids, Dave, they had to walk an hour to an hour and a half just to get to school in the morning.
Right.
And Villages in Partnership started a program where they actually were able to get most of these children to at least have bikes. So now, instead of an hour or an hour and a half walk, they at least had like a half an hour bike ride.
Right.
And one of the kids, I remember he told me, you know, we were just kind of asking, like, what has that, just having a bike, what has that meant to you? This is what he told me. There's only limited daylight in the day there, right? So they had to account for an hour and a half walk home, so they could only stay at school so long because they wanted to get home before it was
Right.
dark. So the bike ride, instead of an hour and a half, an hour walk, they could bike half an hour. So he was excited not to get home, to turn on his Xbox, to turn on the TV, to go play. He was genuinely so excited because now we can stay at school longer. We can
Yeah.
stay at school longer and stay with our teachers longer and learn more. That was his focus, not, again, I just contrasted to what I would expect kids in this country to say. They'd be like, "Oh, great. Now we can still get out and get home earlier and play sooner." But he was just so grateful for the education that he was being provided, and now he was going to be able to even stay longer and learn more. And that just really, it's like, wow, that really struck me. And that level of gratitude, though, just permeated the whole experience. It was kind of a higher level picture of what the experience was like. As I mentioned, these people have nothing. I mean, so many of them, again, American minds, I don't think we can even really fully fathom what some of these people face. In the midst of truly having almost nothing, we'd go into these small villages. These people that we met were the most genuine, the most grateful, the most gracious, and on top of it all, the most happy, some of the most happy people that I've ever met, Dave.
Isn't that interesting?
It's still, I mean, I'm only about a month out of being back from the trip, and I'm still processing a lot. I think I'm going to continue for months to still just kind of process the whole experience, what we saw, the people we met, the conditions we treated. But that was one thing that stuck with me, is like, why comparing again? All I really know is home, right? I know America, I know the United States, and as we mentioned earlier in this discussion, if you track through all of human history, I don't think many people would disagree with the argument that this is probably, the U.S. is the most affluent, um, wealthy, materialistic society to ever exist. We have so much to be grateful for, but we are seemingly so unhappy. I mean, you read happiness scales and surveys, and we rank so incredibly low. And I left Malawi, and I was just like, again, in the midst of having nothing, why are they so much happier than it seems like most Americans? And I'm still trying to figure that out. I've identified, I think, two key things that I saw, that I think are accountable
Yeah.
for this.
Tell
One of
us.
which, yeah, one of which, and I might be off with this. I don't know. And you might talk to me in a year, and I'll come up with maybe a few more items or change my view. But as of now, that's the two biggest things that I've boiled it down to, why they are just genuinely seem to be so much more happy. I think number one, the biggest thing that I saw was their faith system. And I don't, I was brought up a Christian, but I don't necessarily mean that. I don't care if you're Jewish, you're Muslim. I think just having a faith, having a transcendent faith, believing in something that's bigger than yourself, not
Hmm.
just me, the here and now, the present moment, believing in something that's beyond you. I think that's critical. And these Malawi, I mean, it happens to be 80% of the country is Christian, and they're not just, oh, I identify myself as a Lutheran, as a Catholic, as a whatever.
Right.
I mean, they are devout. Before every meeting we would pray before, we'd pray after. We got the privilege to worship with them one Sunday. Their church service is 3 hours long. I mean, singing and dancing. There's a women's choir, a children's choir, and I mean, just so passionate. And they've done, it seems like, such a wonderful job of imparting it in their younger generations too. The children were as excited
Hmm.
as the adults to be there, to worship, to pray. And again, I don't, I think the critical thing is just believing in something beyond yourself, and not just my wants, it's just me.
Right.
No, it's, that was the biggest thing that I think that I identified for why and again, contrasting that to the United States, where I think unfortunately there's a growing secular aspect to this country. You look at the average age of most congregations; it's probably in the 60s or 70s,
It
and
is. Yeah.
our generations seemingly are just not finding the value in having a faith system. The second point that I think was really critical for this difference in happiness, even in the midst of having so little materialistically, is there's such a strong sense of community there. Again, contrasting it again back to the United States, because it's what I know. I feel like here it's the me, me, me culture, right? Growing individualism every day. I feel like that it's just more and more about who my wants, right? I don't know where I read this before, but where we're no longer that front porch society where people sit out on their rocking chairs and say hi to their neighbors and wave to people on the
Right.
street. Everybody wants to be on their back patio in a secluded, fenced-in backyard. And that's I think a great example of what our culture has become. Whereas in Malawi, it's like everybody that you can just get the sense they're in it together. We have
Yeah.
nothing, so we need to come together to make this
Yeah.
work. And you can just sense that they genuinely care for their family members, their neighbors, the strangers. Again, I think that was again another huge factor for why they are so happy.
Yeah.
I think their faith system, their sense of community. We're so plugged in here. We have the access to go on the internet, the phone, and we have all these ways to communicate with people. But we're lonely people. I mean, we are. I mean,
Yeah.
loneliness is a huge.
Loneliness is huge.
I
Yeah.
mean,
It's an epidemic right now.
it's being linked with health factors more significant than like I mean I read studies comparing it to smoking and drinking and
Oh, yeah.
the health effects that they're seeing, the morbidity associated with loneliness, and they don't seem to be lonely there because they
Well,
can't
because
be.
they're not,
Yeah,
because they depend on each other,
no, and
you know?
it truly was inspiring to see that. I hope by me telling everybody I can about the trip, because I feel like there's this concept of Africa, the dark continent, this scary place. Us here in North America, I not once throughout my experience did I feel scared, threatened at all. I mean, the people that I met were just so warm, so welcoming. I hope everybody, if an opportunity like this ever comes your way, don't say no. Really
Yeah.
weigh it, and I urge you to go for it, because you will learn so much. You will come back to this country realizing the
Yeah.
innumerable blessings that we have. It'll recalibrate you, reset you, and there were 21 of us on this mission trip, and I would be willing to bet that every single person would agree with this statement, that we went to help these people in a country that is so poor. But I think we all took home more than we gave.
Yeah.
What they gave to us, what they taught us, yeah, it's just truly unbelievable.
I hear that a lot from people who are living lives of service. You know, it's just being there with people teaches you more, just like you said. What is one thing that I mean, given all this new experience you've had, what one thing would you tell people if they were going to try anything?
So yeah, I think that my biggest takeaway: don't live in fear. Don't close yourself off from the world around you. Other people aren't a threat. They're not dangerous. It's changing that perspective of we're in this together. It's not me against
Yeah.
them. It's us. That's my biggest takeaway, Dave, from this trip. Just say yes to every opportunity that comes your way. Don't be afraid of people. Um,
Yeah. I think that's great. I think that's perfect.
yeah.
You're an inspiration.
Well, thank you. No, I honestly thank you, Dave. I thank you for doing this. Thank you for giving me the opportunity to talk about my experience.
Thank you.